Pre-Health Shadowing is a student-led, minority-led, women-led nonprofit dedicated to helping prospective healthcare students gain access to educational resources no matter their demographic status, abilities, or location. My name is Allie. I'm the Assistant Chief Volunteer Coordinator here at Pre-Health Shadowing, and I thank you all for attending today. Let's go ahead and get started. So just a quick PSA, we do offer closed captionings for all of our sessions to accommodate all of our students. This setting is available at the bottom of your Zoom screen. If you need any help enabling this transcript, please direct message one of our team members. We're always looking for ways to be more inclusive and ensure our sessions are accessible. So please, if you have any recommendations for how we can improve, you can email us at info@prehealthshadowing.com. Since this is an international program, we want to know where are you guys Zooming from today. So go ahead and drop in the chat. I'm calling from Virginia in the US. If you want to stay in the loop, you can follow us on social media. We're active on Instagram and TikTok, or you can sign up for emails on our website so that you never miss a session. We have some wonderful opportunities for you all as benefits of being a part of our program. We've partnered with Kaplan to get our students a 10% discount code that can be used on all Kaplan products, as well as free resources such as study guides to help prepare you for your standardized tests like the MCAT, NCLEX, or PCAT. If you fill out our short survey in the chat, we will get you all signed up for these deals for free. We'd also like to draw your attention to another amazing program, Neonatal. Neonatal is an online mental health platform for students. For pre-health professionals especially, we know that this path isn't easy, and that's why we've partnered with Neonatal to spread the word and offer free access to their services if you use the link in the chat or enter the code PREHEALTH when signing up. Mask for Mask is an amazing women-led organization that donates 4 masks for every 4 masks sold. These go to people in need during the COVID-19 pandemic, such as those in the homeless community, healthcare workers without proper PPE, and others who are struggling to stay safe. With our discount code PHS15, you can get 15% off your order. If you buy through this method, Pre-Health Shadowing will also get 10% of the proceeds, which is amazing because we are a nonprofit that runs solely off of the support of our community. If you want to play a bigger part in supporting PHS, we would love for you to join our network of student volunteers and team members. You can apply to be a part of our administrative team and lead professional outreach, grant writing, various projects and initiative in our volunteer program. We understand that as a pre-health student, you may not have all of the time to dedicate to this, so we also offer the opportunity to volunteer asynchronously with tasks that can be done on your own time. We would love to have you be a part of this program and contribute your own unique perspective. If you're a high school student and want to get involved, we do have a program called HTP, High School Training for PHS, which allows you to connect with college pre-health programs, get involved in fundraising for PHS, and organize resources for other high school students interested in medicine through pre-health shadowing. We want to recognize the hard work of all of our students in the program. So if you're interested in getting published, you can submit essays, reflections, research papers, and reviews to our editor-in-chief through the link dropped in the chat to have your work on our website. This will look great on CVs, applications, resumes, etc. So take advantage of this. Part of our mission at PHS is to promote diversity, and in order to do this, we have launched an initiative to have monthly panels to celebrate different demographics in the field of medicine. Some of these upcoming events include a series on patient experiences, a COVID-19 roundtable, and an international student forum. If you have a mentor, professor, or professional that has inspired you and you think that they can contribute to these conversations, please nominate them today using the link in the chat. If you can, we humbly ask that you donate to our program. As you know, pre-health shadowing is completely student-run, and we are working around the clock to keep this free and accessible for everyone. Unfortunately, Zoom and our website are not free, so any contribution you can give would be greatly appreciated. If you're not able to donate, we request that you send this link to someone that you think can, so we can continue to support those who cannot afford similar opportunities. Throughout the session today, we encourage you to drop any questions you have for the speaker in the chat. Our team members will be making note of these to be asked in the later half of the session. Take good notes as our professional is going over their presentation, as there will be the chance to take a post-shadowing assessment to verify your virtual shadowing hours. More information will be available on this at the end of the session, so stay tuned. Lastly, if you can, we request that you turn your cameras on. This is by no means an obligation, as we are respectful of different circumstances, but it does help us feel closer together in a time when socially distancing is mandatory. I appreciate listening. Now, I would like to welcome our professional today. Thank you so much for joining us. You can go ahead and share your screen whenever you're ready.
Hello, everyone. My name is Dr. Lorraine Shields, and I'm so happy to be with you today. I'm going to pull my PowerPoint up here as well and share my screen. There we go. And let's get started from the beginning. Okay. As I said, my name is Dr. Lorraine Shields from California Baptist University. And I first wanted to start by sharing some disclaimers with you. I'm not receiving any financial compensation for this presentation, and all of the presentation is my original work. No part of the presentation, content, or photos can be reproduced without approval from the presenter. And I do want you to know that although I work for California Baptist University, I was contacted to give this presentation. And so I'm not being sponsored by California Baptist, and the views expressed are my own. Okay, so let's get started here. I'm going to ask first to get a little bit of information about you. So if you can pull up those polling questions for me, I'm asking you 3 different questions. I would like to know your education. So are you a high school student or a college student, or perhaps you're not in school at present? I'd also like to know what area of health you're looking at. Health providers. Is it medicine, nursing, maybe one of the therapies, physical therapy, occupational therapy, respiratory therapy? Perhaps you're interested in becoming a pharmacist or working with some other departments such as lab or imaging. Or maybe I haven't even listed what you're interested in, so you can click other. And then lastly, I would just like to have an idea of where you're coming from. So are you from the US, or are you from outside of the United States?
I'll leave the poll open for about 5 more seconds. I see we have a few participants that still need to answer. So in a few seconds, I'll go ahead and end that poll and we can see the results.
My plan for this afternoon is to give you a little bit of background, my personal experience, my education and training, my area of practice, and then tell you as well some information about how you can get into nursing. There's many ways that you can become a nurse. And then we'll close after that, and I'll be open to any questions that you have. So I see that it's almost half and half. High school students and college students. And I see that there are a lot of individuals interested in nursing. I can't see, let's see, the rest of the, let me see if I can go back here now. I moved this. Okay, there we are. And a few people, so it's mostly medicine and nursing. Okay, and I think there's one more question. Okay, looks like Canada, and I don't know the person. Oh, there it is. Of course, majority are from the US and some from Canada. Okay, all righty. So let me see if I can go back one slide. Oopsie, I'm moving forward. Okay. just start fresh here. All righty. So I went over the disclaimers and the polling questions. So I am a nurse. I've been a nurse for many, many years. And I can tell you that even after 40 years of nursing, I still love the profession because I love the impact that we can make in patients' lives. I love the impact that we can make in improving outcomes for our patients. And so I'm just putting here for you a definition of nursing by the American Nurses Association. And this is that nursing is the protection, the promotion, optimizing health and health abilities, preventing illness and injury, alleviating suffering, and also advocating for our patients, families, communities, and populations. So our job is very big, and the opportunities to make an impact in not just in our patients' lives and our families' lives, but also in healthcare in general, is immense. So I want to tell you a little bit about my journey, why I chose nursing, my education, my area of expertise, my clinical journey, and my academic career. And I share these things with you to inspire you, not to boast, but to inspire and to show you that there are so many opportunities available when you choose a career in nursing. So why nursing for myself? My father takes credit for inspiring me to become a nurse. He kind of discussed nursing since childhood. And so I enrolled at the UCLA School of Nursing and got my bachelor's degree there. And I'll tell you the honest truth, when I finished nursing education, my first thought was, what was I thinking? Because I wasn't sure that this is what I wanted to do. But thankfully, I had dropped into an area of nursing that captured my heart and has set my heart on fire all these 40 years. And I'm going to share that with you. So let me move to the next few slides, and then I'll discuss these different aspects of my life in nursing. So I mentioned that when I finished nursing school, I wasn't really sure what I wanted to do. I knew I loved cardiology. I loved the heart. I love how logical everything is about the heart, the mechanics of it, and how it impacted everything else that happened within the body. So when I finished nursing, I thought I would find a job in cardiology. And at the time that I graduated nursing school, there was a huge nursing shortage. So I interviewed 8 different hospitals, and they all were willing to offer me a job right out of nursing school. Not only offer me a job, but they were offering huge bonuses at the time because there was a large nursing shortage. The very last cardiology unit that I applied to, they told me that they had openings in cardiology, but they really had a great need in neonatal nursing. And my nursing program didn't give me any exposure to neonatal nursing, the neonatal intensive care unit. So they took me over to the unit, and once I got there, I knew that's where I needed to be. And so my entire career, the majority of my career, I'll just say, has been in neonatal nursing. Neonatal nursing is an intensive care unit for newborn babies. And so in my career as a neonatal nurse, I had the opportunity to provide nursing at the bedside, taking care of babies myself. An average day for me would be to get my assignment, come in and examine my babies. And then I would feed them, give their medications, start IVs, change IV fluids, and any other procedures they needed. As I got more experience, then I joined the transport team. And on the transport team, I had the opportunity to transport sick newborns. not just between different areas of the hospital. Sometimes babies were born in the ER and they needed to be transported to the neonatal intensive care unit. Sometimes there were babies that were born in labor and delivery that we expected to be completely healthy that had problems. So we had to transport them from labor and delivery to the neonatal unit. But the more exciting part, I want to say, of transport was being able to travel from my intensive care unit to other hospitals to stabilize babies and bring them back to my unit to be managed by our doctors and nurse practitioners. From there, I really found that I loved to teach. I had a few opportunities as a nursing at the bedside nurse to start teaching. And I just found that that really captured my heart. I wanted to be able to understand more and to be able to make nurses stronger in their understanding as well regarding neonatal care. But what I found is that I could not move into those teaching positions unless I had a graduate degree. And that's what led me several years later to go back to UCLA and to get my master's degree in nursing. And when I entered that program, that graduate program, my program was a combination nurse practitioner and clinical nurse specialist. So a nurse practitioner then is different from a bedside nurse altogether, very, very different. She works in the medical model. And so a typical day for a nurse practitioner is she will go in and get her assignment, and she will go and examine her babies and then write a medical plan for those babies. She'll write orders. She'll follow that by doing procedures and writing her medical notes, conferring with the medical staff. So she's working very much at an advanced level, different from a bedside nurse. And I have to say that I loved that role. I was first employed as a nurse practitioner at the county hospital at Los Angeles. And it was a large teaching hospital, continues to be a large teaching hospital. But the experience that I gained there was just tremendous. I couldn't have gotten a better experience if I'd worked at another facility. I worked with seasoned physicians in neonatal. I worked with fellows and residents that were learning neonatal care. I got to be involved in the education of those fellows and residents. So as going back to my regular day then, I would examine my patients, I would write orders on my patients, I would start to do procedures, I'd go to deliveries and manage sick babies right in the delivery room and then bring them back into the intensive care unit and do all the admission procedures, setting up lines, emergent procedures like placing chest tubes and so on. And then I would go on and write my notes, always conferring with the medical staff. I mentioned that my program was a combination of nurse practitioner and clinical nurse specialist. And the clinical nurse specialist role is a role that I just love. After I left the nurse practitioner role at County Hospital, I started to go back to what I really loved. Remember, I told you I loved teaching. And a large part of the role of the clinical nurse specialist is just that, teaching. We're involved in educating staff. We're involved in training other disciplines as well. But a bigger part of the clinical nurse specialist role is being an expert in the field, a clinical nurse specialist. So I was a neonatal clinical nurse specialist, an expert in my particular field. And so I did a lot of consultations with other disciplines, other departments. I did a lot of education with other departments. I was involved in research. So that role to me was and continues to be a role that is multivariate. It's just multidimensional. I get to have my hand in many different pots, making a difference in many different ways for the outcomes of the babies we care for. From there, I decided that I needed to get my doctoral degree. And so I went to Vanderbilt University. And when I finished my degree at Vanderbilt University, then I became faculty at a couple of different institutions. I started by teaching undergraduate students through the university, Cal State University, San Jose. We got to work at Stanford Children's, and Lucille Packard is what it's called. And that was also a great experience. And I also got to work at Monterey, University of California, Monterey Bay, teaching in the classroom. After that, I was hired at California Baptist University. And I started my work there teaching pediatrics. And after I moved from teaching undergrad pediatrics, I moved into the graduate program and started teaching nurse practitioner students and other advanced practice nurses. And the courses that I currently teach are advanced pathophysiology, advanced pharmacology, and advanced leadership. And now I'm also teaching in the doctoral program. Most recently, in the last year, I became director of the Doctor of Nursing Program, Doctor of Nursing Practice program at CBU, California Baptist University. I like to stay current in my clinical area, so I continue to work in the field of neonatal. And so my life really has been very well-rounded. And even as I share my story, my journey with you, sometimes I just can't believe the opportunities that I've had. And I'm just so thankful that now I'm continue to teach in the clinical setting, in the neonatal intensive care unit, but I've moved to being able to teach new nurses and seasoned nurses in their advanced roles. So my journey has been one that's just given me unlimited opportunities and experiences that I could never have dreamed of. I can say to you that there have been lots of challenges, and those challenges have made me stronger. And so I've learned to be able to embrace challenges. And I, again, continue to love my work and my profession. The picture you see to the right, I'm not sure if you can see it, because what I see is the participants for the webinar. But it speaks to my reinventing myself every few years. I was a bedside nurse. Then I reinvented myself and became a transport nurse. Then I reinvented myself and became a nurse practitioner, and then a clinical nurse specialist, and now reinventing myself as a faculty member and a director of an entire program. With that came many challenges and many barriers, but again, they made me stronger. And it's a path that was set before me with doors opening and closing, and one that I can say has truly been blessed. So I wanted to share a little bit with you about how you can become a registered nurse, because there are many, many roads to become a registered nurse. Some of you may be aware that the community colleges offer associate degrees in nursing. Those are 2-year programs. They usually are more than 2 year if you count all the prep work. So you're taking all your English, your basic education courses, English and biology and things like that. Then you move into the actual nursing program, which usually is 2 years. This is the way I became a registered nurse. I went to UCLA, as I mentioned, and got my Bachelor of Science in nursing, and that was a 4-year program. And then I got my master's degree. Now, there's a few ways that you can get your master's degree. This is not the way I got mine, but this particular way is called EL-MSN. So you are able to get a master's degree. They call it an entry-level Master of Science. And so these are individuals that already have a bachelor's degree in something else. Perhaps they have a bachelor's degree in kinesiology or biology, microbiology, and now they'd like to transition into nursing. That particular program is about 4 years because they are taking all of their nursing, pre-licensure nursing courses or the programs they need to become an RN, and then they'll take all the master's level courses. So that takes about 4 years. So those are 3 ways you can become a nurse. Those are 3 ways you can start in the nursing profession. Once you're in the nursing profession, then you can get your Master of Science in Nursing. And the benefits are that there are many opportunities to move beyond regular nursing. You can become a nurse educator, a nurse executive. You can study nursing informatics, and nursing informatics is a very exciting pathway now. That's really, I think, one of the younger tracks that you can follow for nursing. If you really love computers and technology, this is the field for you because you're able to look at and process, analyze. You learn how to work with the data. I'll give you a great example of the need for nursing informatics. When we work in the hospital and take care of patients, of course, many of our patients have monitoring. You can see their heart rate, the respiratory rate, saturations, and so blood pressure. And a lot of what we do has to be charted. And everyone has transitioned over to electronic charting. We don't use paper anymore very much. So you can imagine if we're all using electronic records, someone that has a good grasp of computer technology and a nursing background is the perfect person to take on these roles as in nursing informatics. When we have non-nurses developing computer programs for us, the systems end up being very clunky, very difficult to use. But if you have someone that is a nurse, she knows what nurses do, she knows what they have to chart. When they're developing the programs, they make programs that are very smooth, very user-friendly, and very valuable in capturing the data we need to be able to share with other disciplines and between our profession as well. With the Master of Nursing program, you would also be able to, if you wanted to, have an advanced practice degree. And that's what I mentioned a little bit earlier. That's what I did as getting a master's in nursing. I then got my nurse practitioner and my clinical nurse specialist. Other advanced practice nursing roles are nurse midwife and nurse anesthetist. Lastly, there's one more program that can earn you a master's degree, and that's the RN to Msn program. So if you are if you graduated from a community college and got your registered nurse with an associate of science degree, you can kind of skip over the bachelor's and move right into the Master of Nursing degree through particular programs. And then lastly is the Doctor of Nursing Practice degree and the PhD in nursing. Both of them, we call them the terminal degrees in nursing. These are the highest possible degrees you can get in your profession. Some physicians have doctoral degrees. Pharmacists have doctoral degrees. Some other medical professions as well earn doctoral degrees in their field. These are the terminal, the highest degrees that you can get in your field. And what can you do with that degree? Many things. You can move forward with any leadership roles that you are aspiring to. Nurse executive, where you might manage several departments of a hospital, or even be the chief nursing officer. And then also the advanced practice nursing roles that I discussed a little earlier. So why would you be interested in choosing a career in nursing? There are endless opportunities. And if my story has any thread running through it, it's that I've had and taken advantage of endless opportunities. When I talk about opportunities, I'm mentioning horizontal opportunities as well as vertical opportunities. So what do I mean by that? Horizontal opportunities, remember I said I was a bedside nurse. If I wanted to, I could, as I did, move to something like charge nurse or transport nurse. I could choose to leave neonatal nursing altogether and move to pediatric nursing or orthopedic nursing or any other type of nursing there is. Once you have a foundation of nursing, it's easy to move to a different specialty area because you just need a little bit of training to become skilled and knowledgeable in other areas of nursing. So that's what I mean by horizontal nursing. I've taken advantage of those opportunities. I didn't mention earlier, but I did leave neonatal nursing for a very short time, and I moved to school nursing, where I worked at an elementary school, and it was the only health care provider on campus. And so I had children and families and parents, other faculty members, other teachers coming to me with medical questions. I happened to work in a school that was in a disadvantaged area, and very often I saw students that didn't have primary care physicians. They didn't have a regular doctor that they saw. They came to me as their first medical provider for me to make referrals for them. That was an autonomous role. I didn't have any other medical professionals around me. And I loved that experience. Eventually, I went back to neonatal nursing because that was my first love. So those are horizontal opportunities. In addition to that, there were vertical opportunities that I took advantage of. And that's what I mean when I went from bedside nursing to nurse practitioner and clinical nurse specialist. And then eventually, as I said, I even became involved in the university system, teaching at the doctoral level. Another reason to choose nursing is that it's extremely rewarding. I can't tell you the satisfaction I've gained in knowing I've made a difference in the lives of my patients, one-on-one and with populations, really knowing that I've improved things for patients, improved their outcomes by changing processes, making sure that we're all doing the best practice, using the best evidence, and implementing processes and policies and procedures that will do just that, provide the best care and lead to the best outcomes for our patients. Job security, we're always in need of nurses, and we always will be. We've been predicting a large shortage in nursing for some time now, because we have a lot of nurses that are older now and ready to be leaving the profession, and we need new individuals to come in and come behind us. The other thing I wanted to mention is the financial aspects are also very good. You're always well paid as a nurse. I really pray that you would embrace nursing because of the opportunities, the rewards, and the job security. Oops, I need to go back one more. Let's see if I could do it this way. I'm gonna go back here. I want to go here. Okay. I wanted to be able to share this slide with you, and I'm having trouble seeing it because I see everyone's picture there. So let me see if I can open it up a little bit more for you. This is just a good summary for you of what nursing has meant to me. And it says that nursing is a career filled with endless personal and professional rewards. If you choose nursing, you're choosing to spend your life helping others, using skills that blend scientific knowledge with compassion and caring. And there are few professions that offer such a rewarding combination of high tech and high touch. When you become a nurse, you become a lifelong learner. If you are not a lifelong learner, you're going to get behind. You're going to get behind in the new technologies and the new evidence that will lead you to best practices. So I think I have just a few more slides to share with you. And so I wanted to share just a few pearls from my journey to yours. And the first is you want to have a plan, a roadmap that will help guide you toward that journey that you want to end in, to say. You want to seek an advisor right away, whether you're in high school or you're in college. You want to find an advisor that will help you develop that roadmap, help direct you to the types of classes you need to take and the types of programs that are available to you and the prerequisites to enter each of those programs so you can ready yourself. Another pearl for you is that you want to seek out mentors and you want to find them wherever you can. I can tell you that I volunteered before I even became a student in the College of Nursing. I looked for opportunities such as volunteering at hospitals. I got a certified nurse certificate so I could start doing some patient care while I was becoming a nurse. And I also had the chance to surround myself with some amazing people. Whatever role I was in at the time, I looked for people that could support me, give me good guidance, and lead me down again that path that would support me. There are many internship opportunities available. You just have to look for them. And that's where, again, an advisor and good mentors would help lead you to those opportunities and experiences. And I like to say that you want to find your calling. You want to find something that you love doing, that you have a passion for, because it's going to make a difference in your career. If you wake up every morning being excited about what you're going to do, not knowing what the day will hold, but excited about the opportunities you're going to have, I can tell you that wave of love and passion for what I've done has carried me through these 40 years of nursing. You want to make a difference in the lives of your patients and your families. You want to make a difference in healthcare in general. And I can tell you that from my career, from my bachelor's degree to my master's degree, and especially when I attained my doctoral degree, it changed the way I saw healthcare. It changed the way I saw my role in healthcare and my contributions in healthcare. I knew I wanted to make a difference on every level, not just at the bedside, but in moving policies forward that would enhance the care of our patients and the healthcare of our nation. You want to stand up for what is right, to be able to speak out for all those vulnerable populations you're taking care of, the elderly, the young, neonatal, all those individuals that cannot speak for themselves. And this is where you can gain a lot of rewards. You want to see challenges as opportunities. Those are opportunities for personal and professional growth. I can tell you from my experience, as I tell you, I love what I do for 40 years. That doesn't mean it was an easy road all the time. I encountered many barriers and many challenges from people saying, if it ain't broke, why try to fix it? We should do things as we've always done. Or physicians saying, we're doing it this way because I said so. All those things, all those reasons, all those comments were stated by people that didn't have their patients at their heart. They didn't have their patients as foremost in their mind to provide the best care possible. And so I had to find ways to show that the best evidence was out there, show ways to convince them to move beyond those personal ideas and biases so that we could really, again, move to providing the best care possible to our patients. As you continue on your journey, I ask you to try not to lose sight of your end goal, especially as you're studying. Once you get into a school of nursing and you're going through all your classes, you're going to find it's going to be difficult to attain an associate degree, bachelor's degree, master's degree, doctoral degree. It's hard work. If everyone could do it, then everyone would be doing it. And not everyone is made to be a nurse. So if that is your decision, try not to lose sight of your end goal. Even though you're underneath tons of papers and tests and studying, remember why you chose the path that you've undergone. And lastly, I like to share a comment made by my husband to encourage me on as I was working through my doctoral degree. He said, try to enjoy the ride. You're never going to be in this situation again. This particular day, experiencing these opportunities, enjoy the ride. And that's what I've tried to do in my 40 years, especially in the last many years I've had to enjoy my career in nursing. So lastly, I'm going to share this picture with you. And again, I shared my journey to inspire you, not to be boastful. And I share this particular scripture from the Bible that really is the foundation of my life's work and my life today. It's from 1 Chronicles 28:20. It says, be strong and courageous. Do the work. Do not be afraid or discouraged, for the Lord God, my God, is with you. He will help you until all the work is finished. He will not fail you or forsake you. And I can say throughout my career, I've seen his hand in my life. Doors have been opened and doors have been closed, all for my good. And they've left me to the end of my journey here. I've been gifted by God with certain skills and talents, and I've used those to the best advantage, and all for his glory. Thank you so much for your time. Are there any questions for me?
Thank you so much for that excellent presentation. I feel like we definitely learned a lot. I could see the chat was just blowing up with people saying that how much they love this shadowing session and how great your insight was. So at this time, we will be doing our Q&A session. And so I'd like to invite our participants here to ask questions themselves if they wish. So you can utilize the raise hand function, and I will call on students who do so. If you're not comfortable asking your question yourself, I have also been compiling a list of questions from the chat box, and I will be asking those on your behalf. So I'll just go ahead and start with one of our first questions we had, which was asking about if neonatal nurses are primarily female. So could you kind of touch on that?
I have to say, and the majority of all nurses are female. However, the ranks of the males have been growing exponentially, and I'm telling you, I love working with male nurses. They just have a different way of thinking, males and females. And also, I think that they just bring something a little different to the plate and to the interactions with families and patients. So if you're a male and interested, I'm telling you, the ranks are strong. And I definitely encourage you to join our ranks as nurses in general. Can I ask one? I have one request, and I know it was asked before, but I would love to see your faces. Right now, I'm seeing a sea of names. And if you feel comfortable, I would just love you to please let me see your video screens. Don't be shy.
Awesome. I love seeing people pop up.
Thank you. Thank you. Thank you.
Our next question is, was there anything you didn't expect going into nursing, and specifically in neonatal nursing? So anything surprising?
With neonatal nursing, I was surprised that I chose neonatal nursing. That was the first and biggest surprise. So I will share one little thing that was not surprising, but it was fortunate for me that led me on to move forward in my career. So I mentioned that I had planned to do something entirely different. I intended to do cardiology. And when they brought me into the neonatal unit, I was just overwhelmed. I can't tell you, I got goosebumps. My heart was racing. Sign me up. Give me my scrubs today. I'm ready to jump into this. It was amazing. What ended up happening, I mentioned in my nursing program, we didn't learn neonatal nursing. We learned general nursing. And so the program that I jumped into when I started at that hospital, they started us with a neonatal nursing orientation program at teaching us all the basics about how to do the skills of nursing, how to start IVs on teeny tiny babies, how to feed babies, how to administer medications on a teeny tiny schedule, all about the diseases around neonatal patients. One day, I was in a class and the educator said to the class, she was talking about blood gases, and she said, "I don't understand this, but," and I was shaken to the core. So I told you I didn't have neonatal experience, and here I'm in a class where I'm thinking I'm learning all about neonatal, and the instructor says, "I don't understand this, but." So that led me to go out. I continued where I was working, but I looked on my own for a neonatal course. And so I ended up going to UCI and found a neonatal course that was, I think it was 12 weeks. And then the second one was another 12 weeks. And it was led by a neonatal nurse practitioner. And I was in awe of her knowledge. And that's the first thing that inspired me to teach. And then I sought out those opportunities and I was offered them. And as I said, I shared. Then I moved forward in my teaching career, but that's what the inspiration was. So two things that really surprised me about neonatal nursing, that I loved it, and two, that it led me on a really specific career path. I'll have to tell you, the other thing about neonatal nursing is that you're not only working with neonatal patients, teeny tiny, but I should tell you, in neonatal, it's a neonatal intensive care unit. These are sick babies. So the majority of babies that we took care of were premature babies that were born less than 37 weeks gestation. Just full gestation is about 38 weeks. So less than that are premature babies. But especially at the county hospital where I saw everything under the sun at the county facility, the smallest baby I took care of as a nurse practitioner weighed just shy over 1 pound. So I could hold that baby in my hand. The majority of those babies, the babies I took care of, were premature babies. But we also had big term babies that had other problems. So when we take care of our babies in neonatal, we're not taking care of just the neonatal patients, we're taking care of the families. Because as much as we like to say our babies, they're really not ours. They belong to the parents. And so we have to help prepare those parents to take those babies home, making sure that we stabilize them, we help them get a good start, but eventually they go home to their parents, and we celebrate when they go home because we know we've been successful.
Thank you so much. That's amazing. We did have one student who would like to ask her question aloud. So if you'd like to go ahead and unmute yourself, feel free.
All right, my question is, would you say entering this field was life-changing due to the fact you have to care for such fragile little human? And how would you say it differs from other healthcare areas?
Was entering the career of nursing life-changing? Yes, it was. Yes, it was. I told you, my father really encouraged me to follow that path. And when I did, I kind of followed it blindly. You know, I really wasn't sure about nursing, but I did follow that path at his recommendations. Once I got into it, I still wasn't quite sure. When you're first learning nursing, you're very afraid. You're doing things and in situations that can be very critical, and it grows you professionally and personally. It wasn't until I became a nurse, and I'll tell you very honestly, you don't feel comfortable in your skin as a nurse until you're doing it for 2 to 5 years. For the first few years, you are green as can be. And it takes time to feel that comfort. So I can say, yes, my entering nursing has been life-changing for me. And I am so happy that I chose the profession because of the opportunities I have had. And I don't think that is possible in any other profession. I also want to say that of all the professions, you have doctors coming in once a day in the hospital, once a day to examine their patients. You have physical therapy and respiratory therapy, occupational therapy coming in once a day, maybe twice a day, depending on how ill that patient is, to see that patient. You have pharmacists that are kind of distant, but they're preparing medications and fluids for your patient. They're very involved in the total care. You have X-ray and lab. You have other imaging professionals coming in at different times of the day. No one knows that patient better than the nurse. She's there 24/7. And I mean in shifts, right? And we pass information on from one nurse to the other, shift by shift. So no one has a closer relationship and a better understanding of what's going on with those patients, a better opportunity to make an impact than nursing. So life-changing, yes. And why nursing? I didn't know it at the time, but I can attest to it now. Those are all the reasons that nursing is so unique. And I'm so proud to be a nurse.
Thank you for that answer. That was amazing and super inspiring. I have a question about the emotional burnout that I imagine can come with working from such ill infants. So could you touch on kind of how you handle that?
That's really a great question, and it's not an easy one to answer. Number one, I would say you need to have a lot of support around you. And for me, it was my family, and most notably my husband. I happen to be married to a man who has a daughter that's an emergency nurse. So I can tell you, in many, many areas of nursing, not just neonatal, all intensive care, emergency departments, all areas of nursing, and most recently, because of the COVID pandemic, there's been a tremendous strain on nurses. I know you've heard the stories, you see in the news footage. We've had nurses in the front lines give their lives during the COVID pandemic. Try not to get emotional. Nurses that have been strong and courageous. Nurses that have been innovative in a time that's unprecedented. You've seen people with scarring from masks that they've had to wear for hours and hours at a time, exposure to this deadly virus without the protection that they needed. So I can speak to the situation that we've been in most recently, and I can tell you that I'm proud of nursing. It's interesting because 2020 was the year of the nurse, and no time in history has nursing shone so brightly. Innovators stepping up to the plate. I love, my husband always talks about the Marines, that it's adapt. Hold on a second. I wrote it down for you because I didn't want to forget. And if anybody knows it, improvise, adapt, and overcome. That's what we've done during this pandemic. So I'm proud of what nursing has done and how we've been able to function, step up to the plate, and make innovations for all of the patients that we've and situations we've come up against during this pandemic. Burnout has been high, and I'm really sorry to report there have even been suicides because of the strain of the circumstances that they've been under. So burnout has been historically a problem, not just now. And hold on one little second, I'll keep talking. During this pandemic, but as well as other times. And so I would recommend that you have a very strong support system around you, your family members, friends as well, colleagues, and a lot of the institutions, these during the pandemic especially, but even prior to that, have looked at the problem of burnout and have developed a lot of programs that have helped us kind of find some coping mechanisms to deal with that burnout. So recognize, yes, it's going to happen. But before it happens, you want to shore yourself up. And for me, a lot of it had to do with my spiritual sense, who I was as a child of God, my tremendous strength that I get from my spiritual life, and my fellow Christians surrounding me and supporting me. So any way you can, you need to find support systems. The mistake, I would say, is to try to do it on your own, to think that you're strong enough to handle it, to not seek out, to not recognize that these things are often beyond your control and you need help with it. So avoid the mistake of isolating yourself, of thinking you're strong, you're self-sufficient, you can handle it. Maybe you fear sharing those things that you're going through with your loved ones because you don't want them to worry. But I'm telling you, you're going to need the support. So that's the best advice I can tell you, to seek that support out.
Thank you so much for being so open and real with us. I think it's a really big issue that everyone needs to confront, and it's very important to have those support systems in place. So thank you for sharing that with us. Another question that was asked in the chat was, what do you think is the biggest concern in the US healthcare system? And how do you think that nursing fits into that?
So there's lots of concerns. There's lots of problems with healthcare right now, I'll tell you. However, there are solutions. Some of the issues that we're facing currently are education of the public, and I can speak most recently about what's happening with the pandemic. A great example right now is, the public's perceptions of the virus, their understanding of what the virus is, their understanding of the vaccinations, the treatments. What's been especially difficult for everyone, especially the public, is not truly understanding the virus and the ramifications, the outcomes. And so there's different thoughts on, some people go from thinking it's just like the flu. Let me tell you, we've never seen tents set up and filled with bodies for just the flu. That's different. To the extreme side, thinking of, what do they call it when they have conspiracies and government, we need to look at the realities and the science about what's going on here. And my teaching advanced patho has been really fun during the pandemic. So really understanding what's going on with viruses, how they work, why this one is so serious, education of the public and their understanding. That's one of the big issues right now. But in general, and for nursing specifically, what I'd like to address is in 2010, the Institute of Medicine issued a report that said that nurses really need to be at the table. They really need to be, as I mentioned a few minutes ago, who knows that patient better than a nurse, because she's at the bedside all the time. Nurses, the report said, need to be involved in the change of healthcare. They need to be at the table. They need to be able to work to the extent of their education and training. And often we've been held back. For instance, nurse practitioners in California have not been able to practice independently. We've always had to practice under collaborative agreements with a physician. Now there's a bill in place just now that went to both houses, and it's waiting for the governor's signature to allow nurse practitioners to function at the highest level of their practice. So nurses working, being able to have that autonomy, being able to work to the highest extent of their training and education to impact nursing, that's huge. And so for us, as I said, when I took my doctoral program, it helped me see a bigger picture of who nursing was, nursing's role in healthcare in general. We need to be at that table to stand up, not just for our profession, but to stand up for our patients, to be advocates for them. Because often there are people at the table that are thinking more budget and dollars, and they're not thinking about what's best for the patient or a particular population. So those are the things I think that are really most important related to nursing and healthcare right now.
Excellent. Thank you so much. Yeah, that's definitely a very big issue we're facing. And I think nurses certainly should have a seat at the table, a very good seat at the table. We had quite a few questions in the chat as well, kind of about the path to being a nurse practitioner. So do you have to get a DNP to become a nurse practitioner, or can you have an MSN? Kind of what are the ways to get there? Okay, so there are a few ways. One I mentioned was the master's degree of nursing, and the doctoral degree is another way. As nurses are seeking to enhance our perception as professionals, we're looking for nurses to move to their terminal degrees.
I mentioned earlier that pharmacists are PhDs. Some physicians, not all, have PhDs. There are many professions that are working in the hospital that have their terminal degrees, and we want to be at that level. So even though there are many programs still at California Baptist, we have master's degree nurse practitioner programs. Even though there are many nurse practitioners that are in master's programs now, or nurse practitioners, just as I was, that had a master's degree, we want that group of nurses, those with advanced practice, clinical nurse specialists, nurse practitioners, anesthetists, and midwives. We want that group, especially in their advanced roles, to have their terminal degrees for credibility. Again, because there are many other professions that have their terminal degrees. Beyond just the title, what's important is what you learn in the Dnp program. You learn the importance of the role. You learn how to evaluate the best evidence so that you can bring it to the bedside. You know how to become a systems leader so you can navigate in the hospital setting to get change and to get change moving quickly through the system. So you don't have to get your doctoral degree to become a nurse practitioner, but by 2025, we would like all nurse practitioners to become DNP prepared. So at present, yes, you can become a nurse practitioner through a master's degree or a doctoral degree. One last thing I'd like to share is that many universities now, colleges of nursing, are developing what's called a BSN to DNP program, where you skip over the master's degree. So let's say you are a registered nurse, you've gotten your bachelor's degree, has to be a bachelor's degree. You've gotten your bachelor's degree and you've been working and you really want to become a nurse practitioner. You can enroll in a BSN to DNP program that will take you through right from BSN to the DNP and a nurse practitioner. And that will take you approximately 3.5 to 4 years. Okay, so that is another way that you can do it.
Thank you. That's super interesting. I did not know that there was a way to kind of skip over that master's step if you really know what you want to go into. That's awesome. Kind of on that vein of kind of knowing what you want to do, we had one question in the chat of, when you enter a nursing program, is it better to know what specific field of nursing that you'd like to go into, or should you kind of go into it with an open mind?
I think the best thing is to go in with an open mind. Now, you may decide from a personal experience, you may say, I just really want to become a pediatric nurse. That's great. So you know you have to get your foundation first, but you keep in your mind that you want to go into pediatrics. That's fine. But if you go in and you're not sure yet, you may even change your mind as you go through the program. So just keep an open mind. You don't have to have already decided what area. You're going to be exposed to psych nursing, to mental health, to community nursing, pediatrics, obstetrics, med surg, some critical care. You're going to have a great opportunity for exposure to a lot of different types, and you may decide just then through your program.
Awesome. Yeah, that's great to hear. I think a lot of people kind of go into it and they're not quite sure and they may feel behind, but it's definitely good to hear that you can kind of go into it and just see where life takes you. We had another question just about getting opportunities and like preparing for further schooling. So kind of for all of us who are undergraduates, not into our careers yet, what are some things that you really recommend to prepare you for your career in medicine, especially right now with COVID? Do you have any kind of ideas of how to still get experience?
Actually, it has been hard for nursing schools to get student nurses into practice settings because of COVID. a lot of the facilities closed down those opportunities because of the exposure they might get as they were students. Things are opening up again, which is very encouraging. So I think the opportunities might be a lot easier now and available. But what I would say, and this is, again, I use my journey to help inspire you. I was very active in my college because I knew they wanted, when I applied for nursing school, I knew they wanted well-rounded individuals. So I tried to be involved in different organizations and clubs. We probably have like pre-health clubs or pre-nursing clubs or volunteer activities at hospitals. Even if you could just work in the gift shop, get your foot in the door, and then try to, maybe you can hand out, this is one thing I did. I handed out magazines and a little cart down the hall to different patients that might want them. But then I also got a certified nursing assistant certificate. And that is, you can do that in a very short program in many different ways, doesn't cost very much. And then I could start doing things like taking vital signs and changing beds. I at least would get exposure, and I'd be hearing what was going on. I'd be able to ask nurses questions. They would teach me things they knew because they knew I wanted to be a nurse. And so just seeking out those opportunities, and as I mentioned earlier, mentors, people that work in hospitals, uncles, aunts, cousins, friends, family members that are nurses or in the healthcare field, tell them you really are interested, and they can maybe find some opportunities for you or share experiences with you as well. But what you want to do is prepare yourself as a well-rounded individual so that when you are applying, they can see just that on your application. And you'll have lots of good references. People that have gotten to know you and your work ethic and your desire that can write really good references for you as you're placing your applications.
Awesome. Thank you so much. Another question that we have is, what are the qualities that you think make a good nurse?
I think I mentioned earlier that you're going to be a lifelong learner. That's one of the foremost things that makes a good nurse. You have to be up to date on the latest evidence. You have to be knowledgeable and skilled, and that comes from a willingness to learn new things and an openness to learn the best ways that are the best ways to, again, so you can provide the best care to your patients. But I have to say, the most important thing is that you have to have a heart for it. My nurse practitioner teacher used to say, I can teach a monkey to place an IV line. And she's true, she's right. You can teach anybody a skill, but you can't teach them heart. And you have to have a heart for what you're doing. You have to have compassion for the patients that you encounter. And that heart and that compassion is going to give you a desire to do the best work you can. And the best work you can comes from being up to date, a lifelong learner, wanting to improve and change practices, to become an advocate for your patient, all the things that makes you a good nurse. It starts with having a heart for your patients and a heart for the profession.
That's so amazing. I completely agree. I think nurses are some of the most special people and just have this nurturing soul, and they're amazing.
I did want to mention one thing. That was one thing that was on a slide, that nursing for like 20 years has been the most trusted and respected profession. There was only 1 year that they were not, they fell to second, and that was 9/11. So firefighters and police, they rose to number one. Aside from that, all those other years, nursing has been the most trusted and honored profession. Join our ranks. I would love to, by the way, I think that you probably have my contact information. So if anyone is really interested in a mentor or has other questions, I would be happy to keep in touch with you. So I'm eager to hear about your journeys and your aspirations.
Thank you so much. That's so kind of you. I know so many people are looking for mentors, especially right now. It's so hard to make those connections, but you've really given us a great opportunity here to hear from a healthcare professional and kind of know a little bit more about your story. One other question that's popping out at me, as someone who, has been through a lot of school, gotten a lot of education, do you have like a favorite memory or thing that you learned throughout nursing school?
Wow, that is a great question. That made me, when you were speaking, it made me think of something else. And remember when I said, don't lose sight of your goal. So I'm going to segue just a little bit. When I finished my bachelor's degree, after 4 years of nursing, I said, I'm done with school. That's it, no more. I'm going to go work as a nurse, and I'm done. I will, get a cat, start a family, a car, a new car, but I'm done. And I have to tell you that it really is God's timing, because it took me 10 years to go back for my master's degree. And it took me a little bit longer than that to go back for my doctoral degree. And it's just the perfect timing. And each time that I finished a degree, I was like, okay, now that's done. Now I'm really, really done. I'm not going back. But God had other plans. And again, it's been an amazing journey. So in my nursing career, is there one thing that has really been the most special? Something personal to share with you is that I lost my uterus very early in my life, and so I was not destined to have children. But in my nursing career, I've had hundreds of children, and each one of those has been very special to me. And so I think I've been very blessed in that aspect. So I can't say it's one particular instance. I can look back in my mind and I can picture all these faces and these babies, and still so close to my heart. So it's that opportunity that I've had that has been the most impactful in my life.
That's beautiful. Thank you so much for sharing that with us. We are getting close to the end of our time, so I'll just kind of end this with, do you have any last minute advice or final thoughts that you'd like to leave us with?
I think I've just shared everything I can about the joy that I've found in nursing. And again, I would encourage you to take those pearls that I shared with you to heart, and to really embrace whatever the calling is, whether you choose nursing or some other field. Look at it as a calling, a path that you've been, that speaks to your heart. And for me, it's important that you each have a good foundation of who you are and what you want to bring to that field. And that will take you very, very far. And again, I'm happy to stay in touch with you, answer any other questions you have. And I just wish you the best of luck.
Thank you so much again. We appreciate you so much for coming to speak with us today. I think I could talk to you for hours and ask you questions for hours, but I do want to respect your time and leave our session here. So thank you so much for offering to kind of stay in touch with students who are interested. And if any of you guys are interested in hearing more from our speaker, please feel free to shoot us an email, info@prehealthshadowing.com, and we'd love to get you guys linked up. It's a very special thing about our program that we can bring professionals and students together, and we would love to do so. So Dr. Shields, we do invite you to log off if you wish. We're going to go ahead and go into our wrap-up presentation so that you can all learn how to get your virtual shadowing hours today.
Thank you, everyone. And thank you especially to all those brave souls that turned on their video. Thank you very much. The best of luck.
All right, everybody. Give me 1 second while I go ahead and pull up our wrap-up slides today. Sorry for all my crazy tabs. All right, there we are. So again, just thank you guys all so much for being here and listening to this presentation. We'd like to encourage you all to just kind of reflect on what you've learned today at this session. So some things you can think about: what brought you to the session today? What are 3 major takeaways that you got? And what do you want to learn more about? This writing and reflection certainly is not required, but we do encourage you to kind of take this time to think about this session. And we encourage you to submit this writing to our website for publication and recognition of your hard work, and to enhance any of your future applications. We'd love to feature you guys. If you want to learn more about pre-health shadowing and get involved in our program, we encourage you to visit our website. You can become an asynchronous volunteer to get certified hours through things like professional nominations, graphic design, social media promotion, and more. We're also accepting team member applications if you'd like to take on a more active role in pre-health shadowing, to lead projects and volunteer initiatives, and be up here with us presenting at our shadowing sessions. Once again, we humbly ask that if you're financially able to donate, that you please consider sending a few dollars to us via Venmo or PayPal. It costs a lot to keep our program up and running and free for all of you. So if you're someone who can afford to, or if you know someone else who can, please support those who cannot by donating to our organization so everyone can continue to get the education they deserve. Otherwise, we simply ask you to spread the word about pre-health shadowing so we can continue to reach as many students as possible. Now, for the part that I'm sure many of you have been waiting for, earning your digital certificate today for your virtual shadowing hours. So the first thing you're going to want to do is go onto our website and find our professionals course page. Next, you'll take the quick 10-question multiple choice quiz based on the content from the session today. You'll have 30 minutes per attempt of the quiz to earn a 70% or higher to get your certificate. We know that sometimes technology can be very difficult. For that reason, we do allow 2 attempts to take the assessment. But if you run into any further difficulties, please contact us to ensure that our website doesn't crash right after this, after a high influx of students. We do recommend waiting about 30 minutes to an hour after the session to take the quiz. And that quiz is open indefinitely, so you can take it at any time. Once you've passed, you can click the Finish Course button at the bottom of the professionals page and download your certificate verifying your virtual shadowing hours. If you missed any part of this session, or you want to go back and view other sessions to earn more certificates with your verified virtual shadowing hours, you can go to our YouTube channel and watch our previous recordings. You can also find them via the professional page on our website and take the post-shadowing assessments there as well. Be sure to follow us on social media or subscribe to our email list for the latest updates on upcoming sessions and events. We're currently booked every weekday through June for virtual shadowing sessions, and I hope to see you guys there at many of them. Thank you so much for joining us today, and please stick around if you have any questions for myself or any of the other team members. We'd be very happy to answer anything for you. The shadowing session is officially over, and I invite you all to log off. Have a great night.